This is Muriel Woolley. She's got a chest infection and she's struggling to breathe. As each hour passes, the amount of oxygen in her blood is dropping to critical levels. But a doctor has decided that Muriel has reached the end of her life and will die right here in this room.
So this is my mum's care home, Roxburgh House. This was as close as I could get. She was breathless and she needed some kind of oxygen or something to try and make her feel better. At this point we knew she needed the hospital, she needed the help, but unfortunately she wasn't given that chance.
In the middle of a national health emergency, doctors have made decisions about who lives and who doesn't.
We all agreed that this lady needed help and it was completely denied.
Boris, if it was his mum, I'm sure that he'd want her to have oxygen.
In this pandemic, we look at whether the elderly were placed at the back of the queue when it came to receiving hospital treatment.
We rang quite a few times to get her a hospital admission and that was denied.
She had a right to be treated as an equal of any other human being in the country, and I don't think she was because of her age.
How do you go and tell someone of a sound mind that thinks they could be treated because they've just got a chest infection, that they're going to die?
And what does this tell us about the decisions that doctors have to make?
As a society, we do value the lives of younger people more than older people, and I think across society, most people would feel that that's right.
Should we be doing this? Is this right? Can we learn something? Is there any way that we can explain that?
So I think at the start of the pandemic, we were all very apprehensive. There was a very real concern that the NHS would be overwhelmed with the expectation that we'd see huge numbers of patients coming into hospital. We didn't do so well as a health and care system in how we planned with care homes.
There's one section of society that's admitted to hospitals more than any other, and that's people who live in care homes. Many have thought about what the end of their life might look like. How much treatment do they need? And should their heart stop, do they want to be brought back to life? These wishes can be put in writing. They're called DNA CPRs.
A DNA CPR order stands for Do Not Attempt Cardiopulmonary Resuscitation. So that means resuscitation by pressing hard on the chest, giving that person oxygen when available. And very frequently ribs are broken in that process. But I think as doctors we always have to think about what's the right thing for our patient. And that sometimes can be a difficult and nuanced decision.
In late March, early April, some health trusts and GP surgeries, out of the blue, start to ring relatives whose family members are in care homes to tell them should they need hospital treatment during the pandemic, they won't receive it.
I remember when Boris first said that, we're in a pandemic and that everybody's going to be affected and people are going to lose family members. And I got a cold shiver. I thought, oh, good grief, but didn't think I'd be affected so badly.
Toni Sweeney is 51 and has cerebral palsy. He's a big football fan and goes to the match at least once a week. In April, his sister Lisa found out a GP asked his care home to put a DNAR on every resident, including him, should anyone get COVID-19.
I'm absolutely appalled. I think to put a DNR on everybody, on even old people is awful, but on my brother, who is very young at heart and he has a lot of life to live, I think is an absolute disgrace. When I found out that the home had said, that there was no way they were going to do a DNR on a 51-year-old and that they've got other young people, I was really pleased about that. I thought, I'm glad that somebody's sticking up for them.
Lisa says it got worse. On a phone call with a GP, she was asked about a DNAR for her mum, Margaret Sweeney, a resident in the same care home as her son.
They were asking about whether, has your mum got a DNR? They're asking everybody about this for people in nursing homes. She also said that if she does have COVID and she needed oxygen, then she won't be able to have it. She said it would be too much for her, it'd be uncomfortable. And that's when I said, well, I'd rather her be uncomfortable than dead.
And so with care being discussed in advance, it now appears that some elderly people are being manoeuvred away from hospitals to protect the NHS. In the West Midlands, Helen Keenan was about to have a similar conversation about her 84-year-old mum, Kathleen.
She met my dad when she was 16 and he was 18. They were a great pair because she was very feisty and fiery and he was very quiet and quite gentle. They had a good life, you know.
On April the 3rd, an ambulance is called for Kathleen, who's struggling to breathe because of a chest infection.
Because of the whole COVID situation and her age, I spoke to the paramedics. Obviously he wasn't going to say anything official, but he just said, you know, they're not necessarily admitting people that are representing like your mother.
Did you find that reasonable or unreasonable?
I thought it was totally unreasonable. And in the end, they took her to hospital and we weren't allowed to go. And then we would get a phone call the next day from a doctor to give us more information. He said that there was a point scale, and I think if you got over 8 points, you weren't viable.
This is called the Clinical Frailty Scale. The NHS uses it to rank patients' vulnerability from 1 to 9 in order to prioritise those most likely to recover from a treatment.
Basically, she didn't qualify for the bed, so she needed to go home. It made me feel like she'd just been written off as a human being, really.
Kathleen Keenan died a few days later. In April, news of blanket DNARs finds its way into the inbox of an MP.
Constituents contact me about a whole range of issues. It was a Friday evening and I received an email, and sometimes you really understand how distressed somebody is when they're sending it to you. Her mother, Vera Watt, was in a care home in Salford, and she had received a phone call from somebody at the hospital, somebody who was a speech and language therapist. What she was basically saying was that she had some kind of directive or direction to contact the families of residents in care homes and talk through with them that they wouldn't be admitted to hospital if they had coronavirus. I was shocked, actually, because I've some experience of end-of-life planning and understand the issues in it. And it should be done by a clinician, it should be done by somebody's own GP, by somebody's hospital consultant. It shouldn't just be done casually in a phone call by somebody who doesn't have training to do it.
The Trust apologises to Vera Watt and her daughter for the way the call was handled. Salford NHS Trust told us that there's never been a policy to deny hospital admission to care or nursing home residents. A few weeks later, Vera, who is 79, falls ill again. The hospital admits her for treatment. She's treated and makes a full recovery.
I think it tells us two things, really. It tells us that the focus was entirely on the NHS and an acute sector and clearing people out from hospital and not admitting any more. We did get into a situation where hospital capacity was down to about 55–60% in Greater Manchester. So we didn't have an issue with whether people could be admitted to hospital. It was just a policy line that they would not be.
In mid-April, NHS England warns health trusts and GPs not to use blanket DNARs, calling them inappropriate. It isn't known how many families were contacted during this time.
My mum, Muriel Woolley, she was 73 years of age, but a very young 73 years of age. She loved music, she loved to ice skate when she was younger. 3 years ago, we found her on the floor, and she'd had a bit of a fall. A few days later, we got told it was sepsis.
Sepsis is a potentially life-threatening condition caused by the body's response to an infection. Muriel fought sepsis not once but twice in recent years. Muriel, though, has chronic obstructive pulmonary disease, or COPD, which means she often struggles to breathe.
You're absolute fighter, Mum, aren't you?
You've got me.
In April, Muriel, or Mo to her friends, falls ill again, this time with a chest infection. She is very unwell at a time when the country is in the grip of a health crisis. The care manager at the care home calls 999. Mo's oxygen levels in her blood are below 50%, dangerously low. She's given oxygen by a paramedic and she responds well. But when her GP is called, it's decided that Mo will not go to hospital, but will end her life here.
The paramedics have then liaised over the telephone to a consultant sitting in a hospital who's never met the lady, who didn't even ask to do a video call with the lady, but his recommendation was she stay at Roxburgh House and she was to have a couple of hours to live, because ultimately the way her breathing was and the oxygen levels, she wouldn't live for a couple of hours. I was asked to go and tell Mo that she was going to end her life in the next couple of hours in Roxburgh House. Now that is the most heartbreaking thing I have ever been asked to do. I had to go in the room, I had to come out the room. 4 times it took me, because how do you go and tell someone of a sound mind that thinks they could be treated because they've just got a chest infection, that they're going to die? And she said back to me, why me? Why me? And I couldn't answer her. I couldn't physically answer her.
A GP then video calls Mo to put in place a do not resuscitate order over the phone, explaining that she has just a few hours to live. Would you say that she was refused hospital treatment?
I would, yes, definitely so. Because I think at that time she knew that she was needing to go, and at that point I, thought the same. So to obviously get that phone call to say nothing's going to happen, I just wanted an answer at that point. I just wanted to know why. Why wasn't she taken to hospital? Why wasn't she going to get any other help?
Mo died in Roxburgh House care home 4 days later. The primary cause of death is a chest infection.
You want to go upstairs?
In part 2, we speak to the specialist nurses who say they were left fighting to get their elderly residents into hospital.
He was in pain and discomfort and breathless, etc. That didn't need to happen.
And we look at how a relaxation in laws during the pandemic could stir up problems from the past.
It could put a number of people at risk, because the whole process of death investigation and death certification has been dumbed down because of the pandemic.
Tens of thousands of people have died during this pandemic. In some cases, COVID is the known cause, but in others, it's not so clear. One big question is whether hospital treatment was denied to the elderly in order to protect the NHS.
Thumbs up today. Good. My name is Rachel Hind. I have owned Faversham House since 1999. I just want to talk a bit about the activities, what you're doing this afternoon. I am a trained nurse and worked in intensive care for many years. Okay. All right, thanks Dawn. I shall see you later. I'm just going to see Johnny. Hello.
Who's come to see you?
There's only one Johnny Walsh. You're right. Our philosophy of care is to treat all our residents just with respect and dignity and help them enjoy the last few years of their life. So we have 20 service users.
This is a specialist nursing home. The nurses have decades of experience working here and in the NHS. But during the pandemic, they say it became increasingly difficult to get hospital treatment for residents, and I've come to find out why that is.
We had a lady who had all the signs and symptoms of a lower respiratory tract infection. She was unwell, had fever. We wanted her to have a hospital admission, we wanted her to have IV antibiotics, and we wanted her to have IV fluids. So we weren't allowed to send her into hospital. She was put on oral antibiotics here, and we were denied the COVID testing. We asked for oxygen and we were denied it.
It was a shock. All the nurses that day, we all agreed that this lady needed immediate help, and it was completely denied.
So this lady was flatly denied medical treatment, and you say there's no excuse for it?
Yes, there's no excuse.
Saying it, we just felt like we were just left and pushed to one side. Yeah. That day, I felt like a second-class citizen. It was horrible.
It sounds like she might have suffered needlessly.
She did suffer.
No, she was let down, wasn't she?
Yeah.
And now she's passed away.
Yeah, she's passed away since.
And my question is that in a pandemic, when hospitals are busy, is that a justification?
No, not whatsoever. Not whatsoever. She was still happily living her life. in her own little way, wasn't she?
Yeah.
So why should she be denied that?
It's just unethical.
Care homes and the NHS begin to drift further and further apart, and care homes are asked not only to care for residents in-house, but take on a major role normally carried out by a visiting GP, the recording of deaths. At the time, the government was building temporary morgues, fearing a sudden rise in deaths. Any delays in recording them could see places like this begin to fill up. The Coronavirus Act, given royal assent at the beginning of the pandemic, relaxes the rules around how deaths are verified and certified in care homes to make sure there are no delays in processing the dead. The Department of Health and Social Care said the changes to death certification had allowed public services to manage during the pandemic while allowing funerals to take place.
Dr. Harold Frederick Shipman, driven away to Strangeways prison tonight, knows he will now spend the rest of his days behind bars.
But could there be a more worrying, unintended consequence to these changes? Some of these safeguards were introduced following the conviction of Dr. Harold Shipman, who murdered more than 200 elderly patients in his care. Shipman was able to get away with it because of weaknesses in the way deaths were certified.
And so during the crisis, GPs are advised to avoid entering care homes, primarily to stop the spread of COVID-19. But at the same time, crucially, the law now allows care homes to nominate a competent member of staff who can now verify the deaths of elderly residents in the absence of a doctor. A doctor, therefore, doesn't need to be there.
We've seen evidence that care providers were deeply concerned by this. Here's an email between one care home owner and a local NHS official talking about verification of death, or VOD for short.
I think it is a tall task of homes right now to assess competency for VOD when majority of homes are fighting COVID. If you are expecting us to verify death during this time, it should not fall back to individual care homes. We need protecting. We're all nervous, under pressure and scared.
So some care homes are left struggling to get hospital treatment for their elderly residents, whilst at the same time shouldering greater responsibility for making sure that deaths are recorded properly.
With difficult decisions being made about who receives care and who doesn't, I want to know where the law stands when it comes to some of the stories I've heard from relatives of elderly residents.
I'm Emma Jones, I'm a partner in the Human Rights Department at Lee Day. My area of specialism is in human rights and also in treatment and care of older people in care homes, hospitals, whether or not their treatment is different to treatment that a younger person would receive. I do understand that it's a very, very difficult time for doctors, nurses, healthcare providers, and these sorts of things had to be thought about. But to put out a directive or a blanket policy, I would question whether or not that such a decision would be lawful. We've seen people being discharged from hospitals into care homes with COVID. Is that because the hospital doesn't want COVID spreading in the wards, but it's okay for it to spread through a care home? And then we would ask, well, why is that? What is the demographic of individuals in a care home? Probably older.
And with care homes closed to visitors, staff verifying deaths, and fewer doctors to oversee events, care homes could be seen as less regulated now than they were before the pandemic.
It could put a number of people at risk because the whole process of death investigation and death certification has been dumbed down because of the pandemic. But it seems to me that we are now in a position where there isn't an investigation, or there doesn't need to be an investigation, and deaths potentially aren't being accurately recorded. So are we back in a time as it was pre-Dr. Shipman?
The Department for Health and Social Care says that treatment for any individual should be based on an informed discussion between the patient and their treating clinician, But that's not been the experience for some of the people we've spoken to. Is it right for a doctor to tell someone that they're going to die over FaceTime?
No. No. That doctor should have come to this care home. That doctor should have used PPE, whether it be a gown, whether it be a suit, whether it be goggles, whether it be visors. We've got the facilities here. Why couldn't they come in and say to this lady, did they not deserve that bit of dignity, that little bit of respect?
Do you think it's fair to say that within a pandemic, it was always going to be that the elderly were not going to receive as much treatment as the younger demographics?
So as a society, we do value the lives of younger people more than older people, and I think across society, most people would feel that that's right.
Is it fair to say that because of that, the system was stacked against the elderly?
The system was certainly stacked against older people in care homes.
How do you feel about these big decisions being made with a GP and a patient over FaceTime in a care home in a pandemic?
That's obviously very suboptimal in terms of what we would all want as a way of making these decisions. But in a pandemic, there may not be an alternative.
So can lessons be learnt in case the virus returns?
We really do need a public inquiry to be looking into these issues to explore whether or not there have been mistakes and failings.
And are things any better now than at the beginning of the pandemic?
Are you still feeling the pressure not to admit to a hospital today?
Yes, I think so. I don't think anything's changed massively. We will not allow people to be ignored just because they live in a care home setting.
Do you presume that because she's old, because she's got COVID, then she's a goner? And after a couple of days she perked up and she was great.
If you look at just this one case of Vera, with antibiotics and oxygen, she came back to the care home and recovered. So, you know, how many more people were in that situation?
And can people ever come to terms with losing a loved one like this? This is the first time that you've been back since she died. I mean, how does it feel to be back at this window?
It's awful. It's awful being here and knowing that she's not there. It's very, very hard. And knowing this was the last time that I've seen her. Love you millions.